It's me again, Dr. Jordan Taylor, Undergraduate Exercise Science Program Director and Associate Teaching Professor at the University of Kansas. This is the second video in a three-part series where I am discussing blood flow restriction training, also known as BFR training. In this video, I will cover the guidelines you should follow for a single BFR resistance training workout. When performing upper body BFR training, wrap inflatable cuffs or bands on each arm just below the shoulder muscle and above the biceps and triceps. For lower body BFR training, place the cuffs or bands around each thigh near the top of the legs where they meet the torso. Do not wrap cuffs or bands around the limbs as tightly as possible. Remember that we are trying to trap blood in the working muscle located below the band or cuff during exercise, but not totally restrict blood flow from coming into that muscle. In laboratory or clinical settings, 40 to 80% of total arterial occlusion pressure is typically measured and applied to limbs to safely restrict blood flow during the exercise session. Measuring pressures is not generally feasible for most people, so wrap the upper legs and upper arms at approximately what you consider 70% of maximum tightness. This equates to a 7 out of 10 on the subjective perceived pressure scale that I described in a prior video on BFR training. Basically, you should feel moderate pressure with the bands or cuffs wrapped around your arms or legs. BFR training can be performed 2 to 3 times per week for the upper body and 2 to 3 times per week for the lower body. For a single session, I advise performing 2 to 5 sets to muscular failure or near failure with a light load that is 20 to 50% of your 1 repetition maximum on a given exercise with the muscle included the entire time. Rest periods should be 30 to 60 seconds between sets, but keep the muscle occluded throughout the rest periods between sets for a given exercise. You should aim to occlude blood flow for 5 to 10 minutes during each exercise, with temporary removal of the bands or cuffs only occurring between different resistance training exercises. After the final set of a specific resistance exercise, remove the wraps and restore blood flow to the muscle for at least 1 minute before moving on to a different exercise. It's important for you to know that BFR resistance training is very difficult, even though the loads used are very light. This form of training can be uncomfortable and even painful for a temporary short period of time during your workout. Remember to acquire medical clearance from your physician before beginning BFR training. I hope you have gained a better understanding of how to use BFR training in a single workout session. In the next video I release, I will demonstrate an actual upper body BFR resistance training workout. Thanks for watching.